Today we discuss about USG artifacts. USG artifacts ऐसा टॉपिक्स है कि इसमें से 2 और 3 MCQ हर कॉम्पिटिटिव एग्जाम में आता है. चलिए स्टार्ट करते हैं. Reverberation artifact result from repeated reflection between two strong reflector. Comet tail artifact is a form of reverberation produced by closed space interface. Comet tail artifact is produced by closed spaced interfaces. Next, ring down artifact. Ring down artifact is caused by resonance of trapped gas bubbles rather than repeated reflection. Mirror image artifact occurs when sound reflects from a highly reflective interface before returning. Acoustic shadowing appears distal to highly attenuating structures like bone or calculi. कोई बोन और कैलकुलस के पीछे ये acoustic shadowing आर्टिफैक्ट आता है. नेक्स्ट, posterior acoustic enhancement occurs behind low attenuation structures such as cyst. cyst के पीछे posterior acoustic artifact आता है. Edge shadowing is produced by reflection at the curved boundary of a structure. Edge shadowing is produced by reflection of curved boundary of a structure. Next, refraction artifact causes duplication or lateral displacement of structures. Side lobe artifact arise from low energy beams emitted outside the main beam. Grating lobe artifact occurs in array transducer due to secondary beam formation. Slice thickness artifact is caused by echoes from outside the intended imaging plane. इंटेंडेड इमेजिंग प्लेन से बाहर कोई इको आ जाए तो ये स्लाइस थिकनेस आर्टिफैक्ट आता है. बीम वाइड आर्टिफैक्ट reduces lateral resolution when the beam is wider than the object. Speed displacement artifact occurs when the assumed speed of sound differ from 1540 meter per second. Multipath artifact result from indirect sound path before returning to the transducer. Range ambiguity artifact. Range ambiguity artifact occurs when echoes from one pulse returns after next pulse is emitted. Aliasing occurs when Doppler shift exceed Nyquistic limit. Aliasing artifact when Doppler shift exceed Nyquistic limit. The Nyquistic limit equals half the pulse repetition frequency or PRF. Nyquistic limit equals half the pulse repetition frequency or PRF. Increasing PRF reduces Doppler aliasing. Lowering Doppler frequency reduces aliasing. Baseline shifting is a method to reduce Doppler aliasing. Continuous wave Doppler does not suffer from aliasing. Color blooming result from excessive Doppler gain. Color flash artifact is produced by patient or probe motion. Twinkle artifact or twinkling artifact is commonly seen behind rough calcified surfaces. Twinkling artifact is commonly seen behind rough calcified surfaces. Next, spectral broadening may occur due to large Doppler sample volume. Spectral broadening occurs due to large Doppler sample volume. Wall filter removes low frequency signal from vessel wall motion. High wall filter may eliminate slow blood flow. Anisotropy is most pronounced in tendon and ligament. Tendons appear falsely hypoechoic if the beam is not perpendicular. Tendons USG में hyperechoic आ जाता है if the beam is not perpendicular with the tendon. Next, speckle is caused by interference of scatter echoes. Speckle is caused by scatter echoes. Harmonic imaging reduces side lobe and reverberation artifact. Harmonic imaging reduces side lobe and reverberation artifact. Tissue harmonic imaging improves contrast resolution. Compound imaging reduces speckle and edge artifact. Spatial compounding may reduce posterior acoustic shadowing. Acoustic enhancement is hallmark of simple cyst. This acoustic enhancement artifact is a hallmark of for simple cyst. Clean acoustic shadow strongly suggest calcification. Dirty shadowing is commonly produced by gas. Ring down artifact is characteristic of gas collection. Mirror artifact commonly occurs near diaphragm. Beam steering can reduce anisotropy. Increasing frequency improves resolution but increases attenuation. Lower frequency probes reduce attenuation artifact. Excessive gain increases image noise and clutter. Time gain compensation or TGC correct depth डिपेंडेंट एटेनुएशन. TGC USG में एटेनुएशन एडजस्ट करने में काम आता है. दिस इज ऑल्सो वेरी इंपॉर्टेंट टू नो फॉर अपकमिंग एग्जाम. Incorrect focal zone replacement degrades lateral resolution. Slice thickness artifact can mimic sludge in the gallbladder. Side lobe artifact may create false internal echoes within cyst. Reverberation artifacts are common with metallic foreign bodies. Harmonic imaging suppresses near field clutter. Next, the three most frequently tested ultrasound artifacts are acoustic shadowing, posterior acoustic enhancement, and reverberation.